Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters report, we are sitting down with Dr. Tom Weida. Dr. Weida is Associate Dean for Clinical Affairs for the college and Chief Medical Officer for University Medical Center, which the college operates. He is also Professor of Family, Internal, and Rural Medicine. Thanks so much for joining us, Dr. Weida.
Thank you, Tamika.
Today's topic is RSV. Tell us, what is RSV?
RSV is a virus. The long name, I'm going to try it, is respiratory syncytial virus. Wow, I got that out there. And that's why we call it RSV, because trying to put that out is tough. And it's a virus that usually comes out in the fall to the winter, affects a lot of kids, young kids. And the problem with it is that it really is a respiratory illness, respiratory disease, and a lot of children then develop trouble breathing, lots of secretions, lots of mucus, and a lot of times we call it croup. And that can end up with the children being placed in the hospital because it's so severe.
And what are the signs?
Well, again, the signs are going to be the congestion, runny nose, fever, chills, and just trouble breathing. It affects adults as well as children. Certainly folks that have lung problems, smokers, things like that, are at higher risk of severe events. And every year there are, for children, up to 300 children die from this. There are numerous hospitalizations from it for both children and adults. Adults, up to 160,000 get admitted, and there can be up to 10,000 deaths for adults over 65 for this RSV. So it's not something to play around with. It is severe. It is concerning.
How do people get it? How do the babies get it?
Again, it's a respiratory illness, so it's done through the air or through contact, hand to hand or hand to nose. Little kids, babies, they don't know to wash their hands because they're less than a year old, so they don't do this kind of thing. But it is passed through the air and passed through contact.
I have a lot of moms who are on Facebook and they post like, don't kiss the babies. Does that have anything to do with it, like people kissing babies?
Well, if you have RSV and you kiss the baby, it's very likely you could pass it on. So, it depends. If you're healthy, probably not. Now, what we never know is who has an asymptomatic infection of RSV, because all viruses, people's responses are very different. Some people are very resistant, some people are not.
And talk a little bit about why it's so serious.
Well, it's serious because it shuts down the airways, particularly of young babies, newborns. This is really the major area. And that's because their little airways are little airways. They're very small, so they don't have a lot of room for any mucus to collect in there. And so that closes off the airways and they can't breathe as well. So we end up having to treat them with oxygen, with humidification, with what are called bronchodilators, things to try to open up airways as much as possible, and even at times some antivirals, but those are usually done in the hospital, only recommended for very sick kids.
And it seemed either last year or year before last, there were a lot of babies, hospitals were inundated. Why do you think it was so bad?
Well, we've had a couple of years where people were wearing masks, and so these viruses were not passed as much. We were maintaining distances. We were washing hands. We were doing all these things to help prevent COVID. Well, guess what? We prevented RSV. We prevented flu from being around. But now we're starting to act normally again, not taking as many precautions. And so as a result, these viruses can pass. So if you're feeling sick, if you're having symptoms, I certainly recommend either wear a mask or don't go to work and sort of stay away from people so you don't give it to somebody else.
And who mostly gets RSV? I think you mostly touched on, is it babies up to a certain age or older people?
Yeah, RSV, certainly under the 1 year of age, and the elderly. Over 65 are mostly prone to the RSV. Sort of, if you're a healthy 20 or 30-year-old, probably not a problem. And so the vaccines that are out particularly are targeted towards those age ranges.
So why do you think babies and older people are more at risk for RSV?
Well, the babies, like I said, have the small airways. The older people have multiple other diseases, and so they may have more lung problems over time. They may have heart problems over time. They may be frail. And so if they're frail, they're going to be much more likely to pick up an infection.
Is it contagious?
RSV is very contagious, yes.
Why is it contagious?
Pardon?
Why is it contagious? That's all.
It's contagious because it's spread by secretions, by droplets, by sneezing, by contact. And so just like most infectious viruses, it can spread quite easily, and it's designed to spread.
Tell us a little bit about the vaccine.
Vaccines are new. This is the first year that we've had vaccines for RSV. And this is, I think, a major breakthrough. And so the vaccine, the one set of vaccines are for those who are over 60 years of age. It's one shot, should protect at least through the season as far as we know. You also can give the vaccine for younger children as well. But there's also an antibody that is given for children less than 8 months of age. And this way, this already has the antibody, already has the protection against the RSV. And so that's very limited. It hangs around probably for about 5 months. Usually it's only one shot for those under eight months of age. On the other hand, if those children do have some respiratory problems or cystic fibrosis or something like that, the next season they could get another shot to protect them. But there's a brand new one also that's been approved by the FDA, which is given to pregnant women. And the advantage of that is it protects the newborn. So as soon as the baby is delivered, that baby is protected against RSV. And so that immunity is passed on to the baby because the baby has mom's antibodies.
So when the mom is taking the shot, does she have to be like a certain month pregnant, or how does that work?
Yeah, it's sort of later in pregnancy that they give that shot. It still hasn't been distributed yet. The CDC still has to put guidelines out, but the FDA has approved it. I suspect that will be ready in time for RSV season, which again will be end of September, starting October, so that should be available. The other shot for the adults is available slowly. It's coming online.
And how long does it stay in the body or protect against RSV?
Again, we would say that's probably for the season, and it looks like I would suspect that RSV for adults may need to be repeated each year. Although again, they haven't really put out the guidance yet on that. It's still fairly new, but the studies have shown good protection. And again, most of these vaccines, although you may get some RSV, are really designed to keep you out of the hospital. Because once you're into the hospital, you're at risk for bad things happening.
And when should we get the vaccine for RSV? When is a good time to get it?
The RSV vaccine probably will be, like I said, available here in October, September, October. You can get it in the fall. That'd be a good time to get it because RSV, again, is going to be more prominent in the winter months. Everybody's inside, a lot of closed quarters, so infectious diseases do pass pretty quickly. We're still not sure. There haven't been the studies to show whether that could be given with the flu shot or with the COVID, so we do recommend separating that one right now.
And tell us again who should get the RSV vaccine.
RSV vaccine certainly should be given to adults over the age of 60, and the antibody should be given to children under the age of 8 months, and when available, pregnant women should get the RSV vaccine to help protect their newborns.
Anything else you want to add about RSV?
It's an illness that can be prevented, that we can decrease with the use of vaccines. Vaccines have been around for hundreds of years, and they work. That's why we don't see huge outbreaks of measles, of German measles, of chickenpox, because these vaccines have helped protect us from these very terrible infectious diseases. And now we have some new ones that can do even more good.
Thanks so much for joining us, Dr. Weida, for this week's Health Matters Report.
Thank you, Tamika.